Hi everyone, I'm Dr. Faisel Syed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Faisel and Friends is brought to you by Primary Care for America, a diverse collaboration of innovators leading the way towards comprehensive, continuous, and coordinated primary care. Today, we're talking to Dr. Kyna Fong, CEO and co-founder of Elation Health, about connecting hearts and health, creating an empathetic EHR. Let's get started.
Hello, Dr. Dan. How are you doing?
I'm doing well, Faisel. How are you?
I'm doing well. It's so good to see you. Kyna Fong, my goodness, welcome. We're so glad to have you.
So nice to see both of you. I think our paths have crossed over time, but I don't think we've had a chance to have a full conversation before. So
this is just such a treat. And actually, I'll never forget, the first time I heard you speaking about how you helped your father in his primary care practice. I'd like for you to, especially for our listeners, imagine like people who listen are like medical students, primary care residents, people who are geeky about value-based care, some of the direct primary care doctors. If you wouldn't mind sharing, the work that you did with your father had such a profound impact on just your career path and your life in general. Like, how do you think that exposure to the doctor-patient relationship, especially through the lens of a daughter and her seeing how her father did it, like, kind of help shape your vision for Elation Health? I mean, you're the co-founder and CEO of this. Like, I would love for people to hear that story.
The short answer of it was my experience helping my dad was certainly transformative. So a little bit of that backstory. I grew up in Canada. My dad was a family physician there. One day when I was a teenager, he sort of came home and said, "Hey, we're moving to the U.S." and I was like, "Oh, interesting." He's like, "I can't practice the type of primary care I want to here, so we're going to move." And we ended up in California. There are 4 kids, but myself and my brother Kyna, who's also my co-founder at Elation. We're the older 2. So we got roped into setting up a practice, building furniture, negotiating with insurance companies, doing the billing, the whole 9 yards. And working in the practice on the front lines was it was eye-opening in terms of understanding how important and personal the relationships are between, a primary care physician and their patient. And, just sitting in the front as the receptionist, the patients love to talk to you. My dad took care of a lot of elderly patients, and, they tell me stories about how different ways my dad had helped them, different things that they're comfortable sharing with him because he's so nice and so easy to talk to, and how they want to do, they want to take the meds that he told them to take because, they like him so much. It's just clear that you could be the best. One of my takeaways was always like, you could be the best, like the most knowledgeable physician, and you can diagnose, you can assess, you can lay out like the best plan. But if that relationship with the patient isn't there, that trust, like you're not going to get the inputs that allow you to figure out what's wrong with them. Like they're not going to necessarily tell you everything. And when you figure out what they should do, it's we sort of I often talk about, physicians, they're not orders, they're, especially primary care doctors, they're wishes. Like, okay, go out the door, leave this, leave our visit. And like, I really, really hope, I wish for you to do these things. Go take these prescriptions, go see the specialist, get these labs done. And so that the power of that human relationship was one of the things that really struck me. Like it wasn't just a transaction of folks coming in and needing to get a thing done and walking out the door. It is really meaningful to them. And that meaning drove the impact, right? It drove actually making a difference in their care and their health. And that was really the biggest thing I took away. The second biggest was how hard it is to get paid in healthcare, but insurance companies.
So you describing that, and the one thing I noticed, so you have a technology company helping support primary care, but I bet none of his patients came out and told you what a great job he did documenting the visit. Are placing the orders, are submitting the bill.
Right. Yes. No. That I think ideally is as invisible to them as that's what they would love to see, is all the attention on them and not on the computer.
What are you doing at Elation to help support that, to help support the primary care providers spending the time influencing the patients rather than doing the clicks and keystrokes?
Yeah, I mean, that is the core of our philosophy at Elation. Like, we've always called it our clinical first philosophy. And, just continuing the story, right? That was initially how we got exposed to primary care, the challenges of running a clinic. And we actually went off and did other things professionally, and but always staying involved in the clinic. We went to college, et cetera.
No, wait a second. You go to college. You've got a PhD in economics. That's not just going to college.
Extended
right?
College. Lots of school. The impetus really was at that point I was a professor. My brother was a healthcare consultant. He was a management consultant trying to help physicians in large hospitals and health systems to, adopt technology. And so we were in our dad's practice. We're like, hey, you should adopt some sort of technology. In fact, my brother was like, hey, Dad, it's embarrassing. When I talk to doctors, they know my dad's a doctor, and they ask him, does he use technology in his clinic? We looked at a bunch of different systems, just earnestly. We had our own careers, we're doing our own thing, and just earnestly trying to find something to put into his clinic. And I think what was clear to us is, these systems weren't really built for clinical care. They were built first and foremost for billing. And then, with meaningful use and all these incentives that said, hey, if you have a distribution channel to get an EHR in a doctor's hands that checks the box for them and gets them, their 40K plus check, you should do that. And so these systems were, thought more of as addendums to billing software and serving the billing needs, as opposed to how do you really build something from the ground up that drives clinical care. And I think from there, right, is, and that's the problem we set out to solve, and eventually, build software, quit our jobs, et cetera. But I think it's at the very heart of what Elation tries to do, which is allow physicians to focus on their patients by making technology just work. And, ideally it fades into the background and isn't a thing they have to think about. Like, we don't want to be on their minds. We want to just make their lives easy. And there are so many things that get in the way of that. And so that's why building this technology is challenging. But we, believe deeply in that mission and that purpose, and see a lot of potential for us to make a big impact. And hopefully we're doing that every day.
I'm now working at City Block Health. And so I'm at City Block, and I'm seeing patients in a virtual manner. So today I had a paramedic, actually right before this call, I had a paramedic with a patient who's been going to the emergency room almost on a weekly basis because of pain that's not being addressed properly. And so I'm not that much clinical, so I rarely have to go into the medical record system. But today there was just a place, I got stuck with a couple places just to drop a couple simple orders. And in that moment, I thought, boy, I feel like whoever made this system, they didn't care about people like me. Like, there wasn't empathy. There wasn't a caring feeling like, hey, this doctor is stressed out trying to fix it's a big problem with a little fix, but there wasn't a care about how we interact with the system. And I know with Elation, you do care. I mean, that you do care about how the doctor interacts with the system. Like, how has that, like, what have you done to kind of think about people like me who want to just help the patients, but I struggle with the interaction with a very good medical record system, for quite right. I mean, it is a good medical record system, but for me, I just want to get it done.
Yeah, totally. And you use the word empathy, which actually is a word we use a lot internally, like put yourself in the user's shoes. One of the things we did early on, and if not for the pandemic, I think it would have taken another trajectory, but we've had to find other solutions. But every employee at Elation used to have to shadow a physician using Elation at the beginning of their tenure. And so you get to see two things. One is you get to walk in the shoes of a physician. And I think most people don't actually recognize all the work that happens beyond just, whatever, the 15, 20, 30 minutes that you're in front of the physician. There's a bunch of prep. There's all this work that happens afterwards. There are the calls that are coming in, for other patients. There are the orders they've set, refill. There's so much stuff going on in a physician's world beyond like what you see as a patient. And so that's number one that we try really hard to give context to our teams about. And the second thing is how they interact with technology and their expectations of it. I mean, building Elation, the first version of software, I was very involved on the engineering side. I did a lot of the building. I mean, it's one of the most humbling experiences, right? Because you build something, you just have in your head, you're like, this is how it's going to be used. Like, this is what I have in mind, and this is what's going to happen. And then you take your software and you put it in front of a real live end user who's trying to do their thing, get their jobs done and live in their context. You're like, whoa, that is not it's humbling, right? Those are the types of principles and values and design philosophies we strive to embed within our teams, and we talk about that a lot. It's understanding like our end users are not ourselves, like we are not the physicians. So set that aside for a moment, question our assumptions, and really try to understand through learning, through conversations, through observation, how software will be used. And it starts with recognizing, acknowledging very first that we are here to build software that physicians love. Like start there. Like that's what we are trying to do. And then from there, there's still a daunting task of figuring it out. But I think it's a really important starting point.
I've only gotten a chance to demo a very small amount of it, but I'm hearing that a lot of the providers are loving the ambient AI. So having the computer listening to what's going on in the exam room. And I'm just wondering, I've got to imagine that with your empathy to doctors, you're looking at that and how it will impact the doctor-patient relationship. And I just wonder where you see that going in the next 5 years.
I'm always cautiously optimistic about, new technologies, but this one's pretty impressive, I will say, even just, in its early days of what we've seen. And it, it's funny connecting the dots. I spoke earlier about technology that's invisible, right, to the physician just working in the background. I mean, this is, case in point of that. Like it's ambient. It's doing work for the physician that they don't have to do. I think it's really powerful, and I think we're just scratching the surface of what it can do. But I do think there are, really important challenges to tackle in really deploying, AI, building trust around, what it's doing and how to understand its outputs and how it works. Because, LLMs are non-deterministic, right? They're much more like people in some sense. Like, you give instruction to a person, maybe you do it, on a Monday and they do it one thing, and then on a Wednesday they do another thing. It's all kind of in the right direction, but it's not like typical software where you program it. You say, if this, then that. And like every time this happens, then that happens, right? There's no ambiguity, no stochasticness in how it works. But, with LLMs, there is a different kind of model, a different mental model that end users need to understand, and also a really important design challenge in communicating what's happening. Like what are these outputs you're seeing? What should you expect? How do you use this most to your benefit? But I mean, the short answer is I think we're just scratching the surface, like drafting.
So one thing for our listeners, and doctors are terrible about acronyms. When you say LLM, what do you mean by LLM?
No, LLM. Yes. Thank you. Large language models. So that's basically the catch-all name for the technology that is popularized as, what ChatGPT is doing. But there are a number of different models out there that have an incredible amount of data that it has been trained on, nearing all the knowledge we have, at least very much that's online, trained on that and deployed to many different scenarios. And in this particular case, what we're leveraging for our customers is the ability to draft notes on behalf of the physician for their review, of course, after ambiently listening to a visit.
I need to let Faisel talk, but I'm going to ask one more question. I was just thinking about this because I was seeing patients this morning and I was driving home to do this, and I was thinking in the car, when you do a progress note, it is a product, right? We're producing something. But who is the customer of the progress note? Because I was thinking, Faisel and I both worked for Chris Chen previously. I remember very early on, he said that long notes don't improve clinical outcomes. And so the question is, who is the customer of the note, and what should we be thinking about as we're building the note? And is the large language model just going to create more chart bloat as we go forward?
This is such a great question. The note is something we spent a lot of time on at Elation, just designing, trying to understand. Because if you look at the distribution of a physician's time, I mean, note is huge, which is why ambient is so, and scribe is so potentially powerful. I mean, I would say you start first and foremost, the progress note is for the care team, for the physicians, right? It has a clinical purpose. Now, of course, I think the elephant in the room is that these notes are used also by insurance companies and third parties to determine whether the appropriate care was taken and whether, there's sufficient proof and evidence of the right payment. And that has, of course, brought huge amounts of challenge to notes being clinically useful. And certainly a lot of EMRs have gone in the direction. And when you're not focused on the clinical, you can fall into this trap, which is, we can guarantee more dollars for the organization by making the note 3 times as long. So it includes every single, possible thing, both from the previous note and from the chart. And, it becomes like a mini version of the entire medical record. Like, sure, that may make it drive more confidence that a payer isn't going to knock on your door and ask you about that visit and whether the fees charged were appropriate. But I mean, it massively inhibits the clinical value of that note. And so there are some classic features in EMRs that we really struggled with that people ask for. It's like, copy the whole note into the next note. It's like, well, is it really what you want to do? And yeah, so I would say the customer of the note, go back to, like the grand rounds of, I think it's like Dr. Weed and how he thought about like the soap note and all that. Like, it's clinical, right? It's clinical first and foremost. And so how we think about it is we always put clinical first. Again, that's our philosophy, clinical first. So get the note so it's valuable to the clinical care team. And then, but we can't forget that there are constraints, like make sure the right things are documented, make sure the codes are there, make sure that the doctor's getting credit. Don't hurt the value.
A big thing also happening at the same time is like so many doctors are working for these massive healthcare systems. 40 years ago, if it was 1984, there's a pretty good chance I'd be just working for myself. And that progress note is to help me recall, right? And that was pretty much it. Like I could care less about, I would care about the billing and all, but I wouldn't have the pressure of like a business person from a hospital system, telling me to, dictating so much of what I had to do. And now there's a movement of us wanting to take back control. Now 70% of the outpatient facilities are run by hospitals, and we as the doctors want to take back control. And our main driver is to restore the doctor-patient relationship. We want to go back to taking care of patients and having what your dad had with his patients, viewing him, not wanting to disappoint the doctor who spent so much time, the doctor who cares, rather than viewing the doctor as the necessary evil. Maybe that's too extreme. Maybe the doctor as the gatekeeper to getting a refill or a referral, right? Like they didn't view your father that way. But now we're trying to take back control. And as we're trying to take back control for ourselves and the patients. And that's happening. I mean, there's an incredible movement. I mean, look at the direct primary care movement. Look at all these value-based care companies, the doctor trying to take back. And so what role do you see Elation playing with doctors like us who are wanting to take back control, more so for the doctor-patient relationship?
That's exactly who we are trying to empower, right? Like we want to, we're big advocates for primary care and the ability for, primary care to be independent. And when I mean independent, it's, you're able to make the decisions that are best for the patient and you're not hamstrung in any other way to do that. And the way I see it is, that maybe, in terms of an analogy, like you can think of what Amazon Web Services did for like SaaS companies, like building websites and companies online. Like you went from needing to have your own servers, like physical machines to put stuff, on the internet and needing to pay for, have a huge amount of upfront costs to be able to host these types of services, all the way to now, in AWS, you can buy a micro, instance for dollars a month that you can be running. You can be up and running in a day or hours. Just democratizing that access to critical technology that allows you to participate on the same footing as big companies with big budgets who can buy things at scale. And so in many ways, that's how we think of Elation. Like, we want to democratize access to great technology that, checks all the boxes for compliance, helps you get paid, helps you understand your performance, and you don't have to be part of a large health system to have that type of technology. And not only that, I hope what we believe is we can actually provide technology that's better than that. Just talking about, if you're building, your documentation around making sure payers are happy with it, but you're missing the clinical part, well, are the outcomes going to be better? Like, are the clinicians going to be better able to see what it is they need to do for the patient, to understand who they need to be working with? Like, there should be so many downstream benefits and you put that in parallel with the move towards more value-based payment, right? Or just more payment that incentivizes care, like good care. And, the tools that help clinicians do that should help drive better performance. So there's a lot. So certainly that movement that you're describing, we see it too. It's super exciting. And the role we want to play is, hey, let's put great technology in your hands and be your biggest cheerleaders to be successful.
Well, then let me piggyback off of that one then too, because we've been so blessed and fortunate to be able to interact with so many doctors over the years, and most of the primary care doctors who aren't working in like a value-based or like a direct primary care subscription model are still heavily, their practices are still heavily based in fee-for-service, and they are struggling. I mean, we've heard unbelievable tight margins, like operating their whole practice on like a 2, 3, 4% margin, literally. Like they're taking care of everybody else before themselves, and they want to make the transition away from what they know, like the devil they know, but it just, to move out from whatever EMR they've been working with, probably the same one for the last 15, 20 years. I mean, I would imagine that's what they know, and they don't want to, they're focused, they've figured out how they've figured out all the workarounds to make it work with them. I mean, there's so many changes that we all wish for healthcare. But especially for these doctors who are still mostly in a fee-for-service practice, working with an older technology, tight margins, what message do you have for them that Elation could do if you had to pick one? If you had to pick one aspect of their clinical life, that hey, just for this alone, at least take a look.
For the physicians that you're describing, who are appropriately anxious around, hey, how do I evolve my business model to move right with where the industry is going and where, you look at what CMS is doing. You stay on fee for service, you are not getting pay increase. You are not keeping up with inflation. You must, we are penalizing you year after year. The more you stay here, you have to go in this direction. But at the same time, the new direction is unknown, right? And if you're operating, like you say, on low single digit margins, like that is a risk that is hard to stomach. And what I would say to them is, Elation is here. What we see as part of the purpose of our software is to make it easy for you to get paid, whatever type of program you are in. And the way we do that is by making it so that in the workflow, you don't have to do something completely new. You don't have to go learn new software, sign up for new sites. Like in the software, we help you understand how you get credit, because you're probably doing the things you need to do. Like, especially in these early stages of value-based programs, they're not asking you to do anything off the reservation by any stretch. And you bring it down to just the basics of, the core measures and aspects of performance and quality that are important. And what we as Elation offer to do is make that simple for you. So you understand it. It's in the software, it's in your workflow, and it makes it simple and tangible. That is a challenge that I think is so important to solve, like you say, because the world is moving. Like, it is moving. And the opportunity we have as technology is to demystify a lot of that and make it accessible, because they will be they can and they will be successful, and it'll be a path that gets them on the fee-for-service train is going to get harder and harder, right, to really squeeze out the margins they need. And so I think it's so important to just have people know there's a partner in their corner that is going to help them make this transition, and to reduce sort of the anxiety and increase the confidence.
It's so refreshing to hear you speaking this way. You've been coming constantly over and over again about the relationships, like the relationship. You care so much about just our human sides of being doctors and nurses and care team members as you're designing this medical record, as you've made this medical record, and it's evolving. It sounds like it's evolving too. What advice would you have for up-and-coming students, people who want to make a difference in healthcare, but they're not clinical? You know, we're meeting a lot of these young people who are not clinical. I'm thinking about my oldest son in particular, where he's at that stage of life where he's like, Dad, it's just so unethical, but I don't know if I want to make a difference as a doctor, because really, you guys don't have that much control. I want to get inside. He's brutally, he's like, he wants to, and he can do whatever he wants to do. And but he wants to make a difference there. So for somebody like him who, not somebody, he's very early on, but for somebody who's further along, non-clinical, wants to make a difference, like about not only the relationship, because we hear so much about the patient-centered, but I'm hearing you speaking about these different relationships. It's like doctor-patient, doctor-team, doctor-doctor. What advice would you give to them about having a culture that's, as they're developing themselves, like valuing these relationships?
It's funny. You just reminded me of the conversation my brother had with my parents, and he's like, I don't want to be a doctor. He's like, you only help your set of patients. He was like, I want to help, I want that to be like times, hundreds, times 1,000. and that was his argument. So he went into, he did a business degree in healthcare. But, I think there is so much to do in healthcare. I mean, it is nearly $4 trillion. Like, it is just massive. And there are ways to contribute and participate no matter what type of skill set you bring to it. And that's actually what I always loved about healthcare, because I was an economist, and I was trained mostly as a mathematician, doing game theory, applying economics. And there's always like an answer, right? Like you solve the problem and you're like, here's the proof. And in healthcare, what always fascinated me is like, it's not one discipline that has the answer to healthcare. It's actually highly cross-functional, and the way and cross-disciplinary, and the way that the best solutions come together are actually through collaboration. Like even technology. Yes, technologists have a huge role to play. We have to build, figure out the products, get them out there. But we have to work with clinicians. We have to work, with the administrators. It's just such a multidisciplinary thing that I would say for anybody who's passionate about healthcare, who says, hey, this is a problem I want to sink my teeth into. I want to have an impact. And I will say healthcare is incredibly rewarding to work within. The closer you are to patient care, the closer you can feel like, oh my gosh, this made a huge impact in this one person's life. And that feels so good, in just, in a really, micro-human sense. But if somebody's passionate about it, just learn and then take the skill sets that you have, the things that you are excited about, the ways you like to approach problems. And if you love doing those things, you'll do a great job. And I think healthcare has a lot to benefit from so many disciplines.
Well, I'm going to make sure to relay that information to my oldest son. And he's only 11th grade. He's still got some time. Right now, his life revolves around wrestling and girls. So he's a little bit earlier on. But my gosh, Kyna, thank you so much for taking the time to join with us today and share with us, your insights. I really appreciate it. Thank you so much.
Yeah, of course. Thank you so much for having me. It's been a lot of fun.
What are your thoughts on connecting hearts and health, creating an empathetic EHR? You've heard ours. Now we want to hear yours.
Email us at faiselandfriends@gmail.com, and your question could be featured on the podcast.
If you like this episode, leave us a review and tell us how we're doing. And don't forget to subscribe wherever you listen to podcasts so you never miss an episode.
Connect Connect with us on social media by following Faisel and Friends.
And follow Primary Care for America on LinkedIn and Twitter.
I'm Dr. Faisel.
And I'm Dr. Dan.
And thanks for listening. This podcast is brought to you by Primary Care for America Collaborative and produced by Split Prism Productions.